Right.
Okay, everyone.
There we go.
Thanks for your patience. So today our icebreaker will be a sugar-free superpower. So we want to imagine that you have a superpower that helps people manage their diabetes. And if so, what would your superpower be? I can start first. My name is Tyler. I'm with DC Health. I'm the community engagement specialist. And I would say a superpower for me would be to teleport. So I could teleport residents to their different diabetes education classes so they could get that diabetes education and manage their diabetes. Also, feel free to put your answer in the chat if you don't feel comfortable coming off of the mic.
I can share as the guest. Hi everyone, Roger Stremming, community engagement manager with Findhelp. As a former librarian, which I always joke I'm contractually obligated to mention, I think I've always wanted the superpower of just having someone be able to like think of a book and have it pop into their hands. So I think getting people the right information, popping it right to their hands is my superpower, and I think that would be my answer, getting them exactly what they need to help manage their diabetes.
Very nice, Roger. I would say I would be able to kind of like blast the sugar as soon as you put it in your mouth so you can still taste it, but then like it doesn't enter your bloodstream at all.
That's a good one, Maria.
This is Amanda. I'm the evaluator with the Chronic Disease Division. I think I would choose like mind reading capabilities so that if I was speaking to somebody about their diabetes, I could say it in a way that that speaks to them.
If anyone else doesn't have any superpowers, we can go ahead and go to the next slide. So the learning objectives for today's learning collaborative will be how to access LinkU, how to leverage LinkU data to enhance program delivery, and how to connect patients and clients to additional resources in LinkU. Next slide. So we're going to formally introduce our presenter, Roger Stremming. He is our Findhelp liaison, and he is also, like he's mentioned before, the community engagement manager. He has over 15 years of experience building strong support systems to help communities stay healthy. As a former librarian, he now works with local organizations, health systems, and government groups to create new and thoughtful ways to support people in need. His work focuses on building trust, sharing ideas, and forming strong partnerships that make a real difference in people's lives. Today, he'll be showcasing how providers and community organizations can leverage LinkU to collect comprehensive data to tell stories about patients and how it can inform policymaking initiatives. Next slide. So now we're going to do an introduction of LinkU. And Roger, I think this is where you can share your screen.
Perfect. Thank you so much, Tyler. Let me get everything set up. Okay, I'm gonna do the thing. Can you see my screen? Great. Okay.
So it's not showing us the presentation though. It's
Ooh.
just showing like on the browser.
Okay.
Just go to slideshow.
Yeah, I was gonna say I am gonna jump. So I have a couple of slides, and then where I want to spend most of this afternoon is actually just showing you a demo, because I think actually showing you what LinkU is and showing how you can work through it is really going to be the best kind of tool for teaching you all how to get the most out of it. So hi again, everyone. Roger Stremming, Community Engagement Manager, Findhelp. I've said that like 3 times now. But Findhelp, just a little bit of background. We are the network, the tech behind LinkU. So if you hear Findhelp, if you hear LinkU, know that it's the same thing, that the Findhelp network is what is powering LinkU. So I had just a couple of slides to kind of introduce who we are at Findhelp, a little bit of overview of what LinkU is, how it's gotten started, how we got here, and then get into a bit more of that workflow of how you can actually use LinkU in your day-to-day, both in connecting folks with help, as well as empowering the people you're helping to actually make those connections themselves. So let's see. All right. So first of all, want to introduce Findhelp, and we're a very mission-driven company. We're a B Corp and a public benefit company, and our mission is to connect all people in need with the programs that serve them with dignity and ease. So we're the nation's largest social service directory and referral platform, and so we build this nationwide network of free and reduced cost programs and have a bunch of free tools and things available for folks to really make this mission into a reality. And all of this work leads us to our vision, right? We have that mission in our heart to get people to where they need to go with dignity and ease. And the way we do that is we envision this nationwide safety net where no matter who you are, no matter where you're coming from, you can easily find the information and the help that you need. And so just to kind of breeze through here, because I know we've had some tech difficulties that have eaten a little bit of time, but just to know a little bit about Findhelp, we work in a lot of different ways and build a lot of tools into the system to make it really easy for people to connect with help, both if they're searching on their own. So if I'm trying to find help for my family or myself, if you are a provider, if you're navigating on behalf of someone, or if you're an organization, right? So if you are a free or reduced cost program in the community, right? Like diabetes coaching or that sort of thing. How do you accept referrals in? How do you connect with people who need help? And how do you track that? How do you get the most out of that to tell your story? And like I mentioned, not only do we provide a lot of things on the navigation side in terms of screenings and assessments and those types of pieces, but we see that the community organizations are the backbone of this whole system. They deserve a seat at the table, and we provide them a whole suite of tools for free, forever, with no contracts, to be able to get their information up on the network, be able to edit that information however they want it to appear, and then be able to set up, hey, if they want to accept those inbound referrals, what does that need to look like? How do people need to get to their door? And then they're able to view all of that through some reporting to make sure that, again, no matter how they're working these, what their workflow looks like, they're getting that data to be able to better tell their story. And so you can think of Findhelp as really this house with a lot of doors. So we call this the no wrong door policy. And really what it means is that we have a lot of partners who are working in the same area, and it's all coming together to on the same network, right? That's the great thing about Findhelp is that we are this large nationwide interconnected network. So no matter where someone is getting help, if they're coming through one of the plans like AmeriGroup or Care First, if they're at a hospital like MedStar, if they are maybe just searching on LinkU because they saw it on the side of a bus or in the metro, they are looking at the same network, they are finding the same help. And so, again, this is just a slide to really simply break it down. LinkU is a version of Findhelp. It is intended to really be the public-facing side, which is why we've put it's funded by the Department of Health, and it was created really to help the Department of Health track those outcomes. And it's really, really grown, as you'll see here. It started back in 2019, and it started in very sort of humbly with a very specific workflow. And then slowly it's expanded to cover other teams, other programs. And now, it's also working alongside CRISP DC, the HIE, utilizing the LinkU community site so that everyone is being funneled towards the same place and they're able to kind of utilize what's already there. So a really cool look at a project that started with a very specific sort of small idea and has just grown organically as people saw the value in it. So primarily when I'm talking about LinkU, and I'll share this with you here, there's two sides of LinkU. There's the community site, and that's linkudmv.org. You can share that broadly. Anybody, anytime, anywhere can go to linkudmv.org and they can type in a zip code and find free or reduced cost programs. That's it. They just need a zip code. And what's great about that is you can use that. Families you're helping can use that. Other partners, other community organizations you're working with can use that. That is that forward-facing side. The staff side, staff.linkudmv.org, is intended for use by staff groups at the Department of Health. So that just allows for a bit more, if you were a part of a navigation team, it allows for a bit more of that data and reporting around what sort of work your team is doing, right? So we could talk a little bit more. I don't know exactly where access is for everyone. Apologies, I work more on the community side, but if you're interested, if you have a team that you say, wow, that would be really interesting, I'd love to know more, we can talk about, hey, where's your access? What do we need to kind of do? So if nothing else, know that today you can start using LinkU DMV to connect people with resources. So, all right.
Roger, I have a quick question. So,
Absolutely.
I just wanted to clarify. So, if you don't use the staff side, you can still track what's happening to referrals that you've made.
Yes.
Okay.
It's much more. The benefits to using the staff side is that you see more of as a team, what kind of referrals are you doing and what's their status. If you're using the community site, you can still send referrals, you can still follow up and track and see what help you're delivering for people.
Okay.
You don't have necessarily that whole team view in the same way.
Got it. Okay.
So feel free if you're working with folks and you still want to do that. And there's still some I'll show you here in a minute, it'll make more sense, but there's dashboards you get access to that still show your work. So it's still possible to do, like, send those referrals and then be able to follow up and say, hey, where are we at? You know, what's happening to them? Just the staff side has more of that like holistic, like team view.
Got it. Okay.
Yeah. Great timing on that question because this is the point where I was going to jump into just a demo to walk through everything. So before I do, were there any other questions on who Findhelp is, what LinkU is, why are we here today, anything like that? Oh, great question, Andrea. So no, to be listed on LinkU or Findhelp in general, all you have to be is you have to have a program that is free or reduced cost, direct to the consumer, or the seeker is what we call them, and oh, Tuesday afternoon, my brain is completely melding. Free or reduced cost and direct to the person are really the main two. So if you have public facing, for instance, this group might have diabetes or food coaching. Those types of things are what we list. So I'll show you how you can check for your program and get that suggested here in just a second. But don't worry, there is no nothing that says you have to be Medicaid or Medicare, or if you have to do certain things. Any other questions before we jump into our demo?
Roger, and just to clarify,
Yeah.
like everyone can use Findhelp, whether you're in Maryland and Virginia.
Yes. Yes. And free and reduced programs. Yes. So if your program, we have several ways of defining that. So essentially, we also work primarily with a lot of community organizations that are like food pantries, right? So that's the definition of a free program, right? If your program has anything like a sliding scale or certain like income or eligibility pieces where, maybe it's either a sliding scale under a certain amount or it's free under a certain amount. Anything like that is what we mean, generally speaking, when we talk about reduced. And then if you do accept Medicaid, we can talk about kind of how we can manage that on the site as well. And I'm just going to drop as we jump into the chat. Thank you for the questions, by the way. I'm going to go ahead and drop if anyone would like to play along at home. I went ahead and included the link for the community site, linkudmv.org. Feel free to click along with me, or if you'd like to do your own thing, you're welcome to do that as well. So let me there we go. Get everything moved out. All right, so okay. Well, apologies, you get to see the bottom of my screen. So this is LinkU. This is what the search looks like. I am logged in right now, so you'll see I have a few buttons down here, but you'll see that the important piece is this main search feature here. So what I want to call out specifically is that on Findhelp, the way that all of our searches work is everything is tied to a certain coverage area. And so the way you start a search is by putting in a zip code. And I mentioned it before when I was quickly going through how we do things, but I want to restate that if you're working with people in the public who need help, if you're working with community members, it's a really good thing to know that the only piece of information they need to get started with a search is a zip code. They don't have to put in their name. They don't even have to put in what really they need. They just need a zip code search to get started. So it's a really great anonymous way for them to find assistance. Not just, obviously, we're here today to talk about diabetes prevention and assistance, but also for everything else that they have going on in their life, right? So little bit of audience participation. What is a good zip code that I can plug in? Ooh, Tyler, quick on the draw, 220. That's a good one. And so I'm going to go ahead and just start with a zip code search, just to show you broadly what that search looks like. If you were taking a look for something and knew specifically where you wanted to start, you can put a keyword into this top box. You can see it says optional here. So you could start a search for food or utilities or anything like that in that top box if I wanted to. But I'll just get started with a general zip code search to show you what this looks like. So this is LinkU once you get started on a search. Few important pieces I want to call out, specifically this number here. This says that there are nearly 3,900 programs available in this zip code. That's a lot, and I want to make sure folks understand where that number is coming from. So that number represents the local, state, and national programs that cover this zip code. So that is every program across all of these categories that is available right now in this area. And I think last time I checked, we are up over roughly about 1,500 across the country, no matter where you're looking. So to have, just shy of 4,000 available is really good. So I can utilize, when I'm doing a search, I can utilize this bar here. These are our categories. You can see when I hover over them, I have a list of drop-down subcategories here. And some of these subcategories, if I hover over them, I can actually see that there's specific tags that I could jump straight into. So for instance, if I'm looking to help someone with housing, maybe they have utilities bill that's really high, they need some help with, I could look at help pay for housing. If I clicked into that, I could see here, there's about 106 programs that help with that need in this area. Or if I know that they specifically are needing utilities assistance, and I don't necessarily want to look at 106 programs, I could jump straight to help pay for utilities, right? So that's one way that I can get more direct to what I am looking for. I also want to call out this search bar up here. Again, this is similar to that bar on the front page. It allows me to type in specifically keywords. So I could see, oh, there's some tags here like food or food pantry. If I wanted to find something that's a specific tag, I could just hit food and hit enter and do a keyword search. It'll also pull up organizations. So if I know there is an organization or a program title that I'm looking for, I can also type that in. So for instance, the Salvation Army, if I want to just jump in and see what they're doing in this area, I can jump straight to their programs from here. Also want to highlight that we have a select language feature here. This is powered by Google Translate, so anything it touches, we can handle as well. And what's great about this is that it will translate the entire site. So this is for not just navigators and helping some of that self-navigation that we've talked about so much, but also if anyone on your team feels more comfortable searching in another language, you can do that here. And it translates not just this front-facing, but also all of the logged-in features as well. So if you're on a team answering referrals or anything, you can work in the language that you prefer. All right. So I'm going to go ahead and start a search for food pantries. I think that's one of the more common searches. And so if I look here, I can see Thrive has a listing here. Sorry, I have to scoot you all out of the way. So Thrive has a listing here, and this is what our search looks like. A few things about this. Each one of these white boxes is a separate service. So you'll see here, this is the Emergency Food Pantry by Thrive DC, right? Thrive is the organization that provides it. This is the name of that service. Some organizations might have one program or one service that they provide, or an organization might have a lot of different programs. The way we list things on our network is that each program, generally speaking, each program gets their own program card. That's what each one of these white boxes is what we call a program card. You can see when this was last reviewed. You can see some information here about what it is, the services they provide. So these are the types of things that they do. This is the populations they serve. So in this case, and for a lot of food pantries, you'll see things like anyone in need, all ages. But for more specific programs, you'll see more specific population tags. And then if I click more info, I'll be able to read some more info about what's going on at this program. I can see things like eligibility and availability. I can see a longer description of what they do, as well as just some connection pieces as far as their website, their phone number, what is their cost. So again, talking about the different ways to illustrate how much this costs for people. We have free, we have reduced cost, we have sliding scale. You can also, I'll show you here in just a minute, you can also update if your program has some of those eligibility, like income eligibility pieces as well. So to make sure, again, as people are searching, whether that's someone searching for themselves or a navigator searching but on behalf of someone, you can easily find some things that, hey, this is going to work for this person, or no, this is not going to work. When I'm ready to share, right? So maybe I like this program a lot and I want to connect with them. There's a few ways I can do that. So you can see there's a print option here. So if you're working with someone and maybe they're not quite ready to make that connection yet, and maybe they just want a hard copy of this information, I can click print here. I can also share this directly with them via email or text. And you can see here, I can send it to a number and also auto-translate it, again, based off Google Translate, so that when they receive it, it'll be in a language that they're going to be able to utilize. And then every program has this sort of teal button over here. This is called our Connect button. And this is going to show you the best way to connect with this resource. And I can see Thrive here has a button that says refer. And when I click it, this opens up Findhelp's referral form. So this is just the generic Findhelp form. And you can see I'm logged in. So it says I'm working on behalf of someone else. I can read the eligibility here. If you're a provider working with people, and maybe I've worked with the same person a few times, if I've worked with them, I can put this information in this, hey, use contact info on file, and I can actually pull up someone's information to autofill based on what's in their profile. So I'll pull in Kian's information here. I could set his preferred language in this box. And then I have the option to mark how to reach out to this person. So I just have Kian's email. So I'll say, give them an email. I could add a comment. This is a great way if I'm sending someone to an organization. This is how I can provide a little bit of extra context, right? If there's important pieces for that organization to know before they get there, this is where I'll want to leave that. So things like, they have a phone that's on minutes. They work till 6 p.m., so call after 6:30. Anything like that, whether it's about reaching out to them or whether it's about their circumstances and why you're reaching out. Anything like that's a really good thing to add to this comment. And then here, this is our consent. And this is a really important piece of the Findhelp network and LinkU as a whole. So Findhelp has what we call per referral consent. So every time a navigator or a person sends a referral through the system, we confirm that consent. And that is, to be very plain, this is just making sure, hey, are you okay if we send your information to this organization? That's all it is. And a lot of folks have a lot of folks are doing that work already. They're asking those questions. Hey, is it okay if I send your info to this food pantry for you to get help? Great. That sort of verbal confirmation is great. Just make sure we're grabbing that consent every single time. And then what's great about our referrals is that they are sort of a need to know basis. So if I send someone to Thrive through this, I know, Thrive knows, and the person getting help knows and is kept in the loop with where their referral is at. It is not visible broadly outside of those teams. Now, the person can obviously loop other folks in if needed, but it's up to them and it's sort of on them to do. It's not just broadly available out of the box. So we take that security and that privacy very seriously, which is why we have the anonymous search, which is why we allow so much of the seeker-facing search pieces, and why we confirm consent every time, because we want to make sure that those folks who are getting help are a part of this loop and are as engaged as they can be. I saw a chat come through. Oh, yeah. Shannon asked, if a person has a caregiver or support, can that person be included in best way to reach them? Yes. So typically what we talk about is, and what I've seen as a best practice for that type of workflow is listing like their phone number here would be their caregiver's phone number, right? We see that a lot when we're working with children, and you can see here in the consent, their person or guardian if they're under 18. So sometimes we'll have the parent's phone number listed. Typically, what we would recommend is then in the comment section mentioning, hey, this phone number is for X, that's their parent or guardian. Here's some more, like that kind of thing. So 100% that, yeah, can be, a caregiver, it can be a support person, it can be a guardian, whatever is needed. But ideally, if you're sending that, make sure you're spelling it out in the comment. There's some places I'll show you we can actually mark some of those relationships on a person's profile, so that if we're coming back to this person and we need to reach out to maybe a caregiver, rather, we can make that, we can denote that out. So, and Andrea says, can you define anyone in need? So that's a good question. And it's to your point, each card have their own criteria for the participant. Yes. And that's why I can't give you a great definition for sort of anyone in need, because every program on the platform can set their own eligibility and sort of define who they consider to be in need and who is eligible for their services. So you can see here, when we clicked into Thrive, they've set their eligibility to be anyone can access this program, right? They've made it, and this is the case for a lot of food pantries in particular, where they might have very broad sort of, if you're showing up, a lot of food pantries now are pretty much no questions asked. You can get assistance. Some might have, you need a proof of some kind of income or whatever the case is, but that's all on that program. So they can set it up however they define that. Recently unemployed definitely meets the criteria for most programs when we talk about need. So if it's a program that's specifically targeting, recently laid off or anything, you can definitely mention that in the description and add that as eligibility pieces as well. So there's a lot of flexibility when it comes to both defining that broadly, what kind of people are eligible for that assistance, but then also defining more specifically, what do you need to access this service? So, right, maybe a program is intended for recently unemployed, and for their eligibility, hey, they need to have proof of, unemployment. They need to have certain things with them, and that can be listed out here so that folks, when they're getting referred, they can do that. Good questions. I appreciate that. One last piece on searching. So you'll notice up here above the search, there are a couple of filters, and I want to just highlight these to you all as you might be connecting people with resources. The personal filters allow you to filter for the person you're helping. So this breaks down the population groups that you might be working with. So things like age group, citizenship, gender and identity expression, homeless situation, you can see here. What's really cool about these filters is that they're dynamic. So if you click personal filters, everything you see here is only appearing because there is some organization, some program listed that covers this area that serves this group and that has it marked as the tag on their program card, which means that no matter if I click one of these, I'm going to have results. So if I'm, for example, if I'm homeless in this area and I'm looking for food pantries that specifically say they help the homeless, I can do that search and I can find, oh, cool, this Covenant House mentions that they serve, homeless, near homeless individuals with a few different needs, right? Both food pantry, clothing, and personal care. And it looks like I forgot to mention this check mark here on some of the program cards. That means that someone from that organization has gone in, said, yep, that's us, claimed their listing, and taken ownership of this card. So that way they can update everything. And you can see CFLS here has actually set up their referrals as well. So I can look at this, and if I want to connect with them at Covenant House here, I can click this, and it looks like they have a phone number. Great, that's the best way to connect with them. So I can do that there. If I'm a navigator, I can also log in and make sure I log that referral. So if I'm connecting someone with an organization that isn't accepting those electronic referrals right now, I can still log that on a person's profile and make sure that my team knows, hey, this is the help we've provided them. And I saw a ding. So Shannon asks, if I, Shannon, receive support from Thrive and then go to YMCA, will my profile be accessible to YMCA, or will they need to create a profile for me? Current features are that they will not have visibility into anything that's happened before. I say it in that way specifically because there is functionality now with Findhelp and the work that we're doing in some other states that allows for a community to tie more of that together. We've talked about it a little bit, and I think down the road that might be how LinkU works as well, where there's more of a holistic view, which allows people to kind of see more of that once they're sort of in the system. But for right now, the work that, let's say, Shannon, if I'm connecting you with Thrive, if I'm connecting you with Thrive and YMCA, I will be able to see both of those referrals because I sent them. You will have visibility because you are the person getting sent, but those two endpoints will not be able to see each other, right? So it allows an organization to focus on the work that you're doing with someone specifically and see the updates and, work with it in that way. But you don't necessarily have that holistic view of like, what else are they getting helped with? Now, I say that I mentioned earlier there are ways for the seekers to sort of loop people in. There are ways if the seeker is sort of on it enough and like knows how it has set up their account, they can actually allow access essentially, but it has to come from them to kind of allow that. So there is a way to do it, but currently that's not super visible. Good questions. Anything else on searching before we hop over to sort of accepting referrals? And I want to move quickly because I know we've only got about 9 minutes left. Okay, cool. All right, so I mentioned the check marks meaning that an organization has claimed. So you can see Thrive here has claimed their program. What that means again is just someone from that organization has said, yep, that's us, taken ownership. When you do that for your programs, you can get access here to a set of tools called My Program Tools. Again, highlighting, I like talking about free stuff. Everybody loves free stuff. All of this is free. Community organizations can utilize LinkU and Findhelp for free, forever, with no contracts. We don't collect data, we don't sell data. It's just a free toolkit for organizations to use. So they can do a lot of things here. They can add folks to their team to set up to receive referrals. They can edit their program listings. So changing things like basically everything that is on these program cards can be updated by the organization. They can also do things like add offices, update hours, and importantly, they can choose how to receive referrals. So do they need what we saw with Thrive, which is just that simple referral form where, hey, we want contact information. There's also the ability to just say, hey, show up on Wednesday nights, right? I have a lot of small food pantries that just say, yep, give us a call, or show up on Wednesday nights. You might see some that say contact on their site. You can see this organization, Damien Ministries, has claimed. That means that they probably have an existing contact form that their workflow goes through. Great. If that is the case and that's where they're comfortable, an organization can just link out to the proper place, and we're happy to feed people into sort of the system that makes sense for them. You can also see, okay, there's one here, this Family Success Center actually has a screener. We have the tools for organizations where if they choose, they can build what's called a screener. That allows them to essentially build a little form, right, that someone has to fill out before they're connected. So it can be things like eligibility, which is why it's called a screener, right? So you can kind of screen for eligibility before someone gets services. But it can also collect things like demographic information. So if your program might be grant funded and you want to answer very specific pieces of data, you can collect that through a screener. And that allows you that we have the ability to gather that information to then make your reporting easier down the road. And then I want to show you specifically that beyond sort of being able to update and add folks to the team and update your program listings, You also have that ability to accept referrals and close the loop on referrals. So when you set up a program to receive referrals, this is what your inbound referral dashboard looks like. And so you can see here, there's the person's name. I can see when this person was referred, who they are, their contact information. In addition, you see the little asterisk is their preferred contact. I can see a little bit about where they're coming from. This drop-down box is how I close the loop. And you can see here, Rowan was referred in December, and we got him help. So I was able to mark this that he got help. When I talk about closing the loop and who has visibility into that, me as the organization receiving this referral, I know that, and I have data that then I can see in my analytics that shows, hey, yep, we've gotten this many referrals and we've closed the loop on them, right? So that we're able to say, we are answering these, we are giving that updated information, and ideally, you're able to show and tell that story of, hey, here's the work we're doing, here's the help that we're providing folks. And then you can see there's a lot of different options. It isn't just yes or no when it comes to closing that status. There's a lot of ways to say what happened with this person. And then if you have multiple programs, you can see them on the left-hand side here. And I can jump between my different programs to see what's going on. And so there's nothing coming into the healthcare clinic right now, but looks like, yep, I had a little notification here and I can see, wow, I've got a lot of new referrals coming into this food pantry that need worked. So you can see here, if I want to read more about Chris, I can click that. It'll take that little new bubble off. And then I can see the contact information and I can work this. If maybe I'm working with someone and they need to come back with, new ID or something like that, I can mark that status as something that's still in progress. We have a few that show that needs client action, pending, and eligible all show that, hey, we're working on it or we're ready for them, but we haven't delivered that service yet. So again, it's about not just being able to show that end result, but working with that other team or that other navigator to be able to connect the dots and make sure that they're getting the help they need. And I'm actually just going to jump into, let me see, Savvy Seeker here. You can see all of these folks have an underlined name. If I click that link, I jump straight to that seeker's profile. So I can see more about their information. And if it's someone that I'm working with more frequently, if I'm maybe a case manager and I'm working with someone, this is where I can see that history of the referrals we've worked with. I can assign that person both to myself or to someone on my team. So I can see Amanda is assigned to that person, but Amanda recently took another job. So I'm going to say, actually, I'll take over on Savvy. So I could do that. Or if I wanted to assign someone else, I can start typing and add someone from my team. This household section is what I was talking about earlier, where if there's that caregiver or guardian or support person, I can actually create a note on their profile that says, hey, this is their relationship with someone. Maybe this is the best contact. This is the best transportation, anything like that. And I can see and start a referral if I even want to. If I'm helping someone, I have this in front of me. We're checking, hey, what's the status on some of this work that we've done? And maybe we need to add another referral. I can jump straight into that there. I can also see if there's any of that back and forth communication. So when you send a live referral, that organization, either if you sent it, you can provide some context. That organization might have a question back and they can add a note to this referral that would be visible to you. So some pieces on the profile itself that you can utilize. So 2 minutes left. That was very quick. Again, apologies for some of the delay. And I'll be sending over a lot more information, and there's some other trainings that you all are free to utilize, both other live trainings, and we do have some videos that show a lot of this as well, so you can access those when you get a chance. Any questions that you all have seeing some of this? Sound good? Sound bad?
I don't, oh, see, Andrea has a question. Is the resource meeting the need of, oh, is this resource meeting the need of the community? It's a
Oh,
great question.
yeah. Resource in like just LinkU in general, I suppose. Cool. Yes. I mean, biased. Findhelp is paying my mortgage, so but jokes aside, yes, I do think that LinkU has been a big success. Um, like I mentioned on that timeline slide, we've expanded from being a very particular tool for one particular team to really being the community resource in the DC area. And it's become really just, I mean, it's taken on its own life again and again. I think it's a really great success story. And what we're finding is that all of the teams that have started adopting this are finding their own success with it, which I think is the best part of this, is that as I tell you all of the things it can do, there isn't a single point where I'm like, this is how you have to use LinkU, right? For your programs, this can be just a resource for your families. This can be something where you think, hey, let's actually directly connect with some of our partner programs out in the community. It can be a little bit of both. It can be neither, right? Like there's a lot of flexibility to it, which means that every department in DOH that's used it has liked it. Every organization out in the community that's used it has found value in it and is able to better tell their stories with this data, which is a whole piece I really didn't get a chance to go into today because of time. But there's just a lot to it functionally that it is this, I have described it a lot to organizations. It is a big toolbox. And being able to say, hey, this is go pick out the things that are going to be valuable to you is a great thing and is really helping, to your point, is how we meet the need in the community.
Mm-hmm. And DC Health, Andrea is here to support our partners in what that looks like. So, you know, tailoring it to your program, your setting, your team, so that we can do just that. The tool is only as good as, you know, those that are using it that are using it optimally. So a lot of the work that we're doing as well is around working with clinical and community partners to support integrating it into their workflows, so that we can adequately identify and connect residents to services that address their needs.
Well, thank you, Andrea. Yeah, those were great questions. I appreciate you, and I appreciate everyone who was able to make it today. If I'll connect you all with the slides that I had, which have a little bit, there's a few slides that go into some more detail about everything, as well as some links to our training, both live training and on-demand training. There's a lot out there. And just in general, if you have any questions, I'll give you all my contact information as well. So I'll be your connection if you have anything and want to talk more about LinkU. I really appreciate you all.
Thank you so much, Roger.
Thank
Yeah,
you.
thank you.
It was great.
Yeah.
Do you?
All right, thanks, everyone.
Thank you so much, everyone. Just quick point, if you're all able to stay on for a couple of minutes and you'd like to share any announcements of upcoming events within your organizations, please feel free to do so now. Anna or Andrea, any upcoming events announcements? And if not, we'll go ahead and move into our closing today. Tyler, do you want to go ahead?
I had problems with sharing it.
No problem.
So we can share it again.
Sure. There we go. Go DC campaign.
Yeah, so for the GoGo DC campaign, we are inquiring that our partners let us know if they would like to have our live boards or the video at their site. Our webinars will now be available on the Living Well website. So if you really enjoyed this meeting today, you could always refer back to our Living Well site to just jog your memory of what we discussed today. And also our next meeting is Tuesday, May 27th from 2 to 3, and you should be seeing communication from Mariana or I with the links and the topics. Thank you.
All right. Thank you so much, everyone. Please enjoy the rest of your day.
Oops, I'm sorry.